The COVID-19 vaccine is here, and you have questions. We have the leading experts here with answers. Sponsored by the Virginia Department of Health.
Thanks for joining us for the exclusive digital portion of Vaccinate Virginia, your questions answered. Virginia's COVID-19 coordinator, the vaccine coordinator, Dr. Danny Avula, is here for the next half hour to answer more of your questions. And Dr. Avula, again, let's start off with the big one. People are worried about the vaccine. People have been asking us, will it cost me? Will it sterilize me? Will it harm me? Can you address those concerns, please?
Yeah, absolutely. So these vaccines have gone through extensive trials. Let's take the cost issue first. The federal government has footed the cost for all of these vaccines. Now, the people who are administering the vaccine, the doctor's offices, the pharmacies, can charge what's called an administration fee to insurance, but if you do not have insurance, there will be no fee to you at all. So be sure of that you can get the vaccine at no cost to you at all. Now, about the safety issue, we have two vaccines that have authorization right now, Moderna and Pfizer. They went through months and months and months of trials, had tens of thousands of people participate in those trials, 44,000 for Pfizer, 36,000 for Moderna, and were found to be incredibly safe, 95% effective, and really very minimal side effects. Less than 10% of individuals had any kind of malaise, sometimes a fever, and less than 1% had any kind of allergic reaction. And so really remarkably safe and well tested among thousands and thousands of people.
That's important to note. Let's also clear something else up. If you're fortunate enough to have received 2 shots, how does your day-to-day life change vis-a-vis social distancing, vis-a-vis mask wearing?
Well, at this point, what we know is that the vaccine is very effective against you getting the disease and having severe consequences from the disease. What we're not sure about yet is if you can still be a carrier and transmit the disease. We're going to need a few more months to collect that data. And so in the meantime, we're asking that people continue to wear masks, continue to socially distance until we can be sure that you can't transmit the disease once you've been vaccinated.
Dr. Avula, what about, let's talk about the CVS rollout. So this week, CVS will begin to administer shots here in the Commonwealth. If you've registered with the state, does that cover you for a CVS registration? Does your CVS registration cover you for your state registration? How does that work?
It doesn't. We tried really hard to figure out a solution with CVS to ensure that people who were on our state registry could get prioritized for CVS's registration. For various technological reasons, they weren't. We weren't able to make that happen, which is really unfortunate. But what CVS did agree to is that they would restrict their access to folks who are 65 and over, which does meet a huge need for Virginia. And they also took our guidance on some of the store placements to make sure that some of those stores were really in some of the most vulnerable communities across the state. So people who want to register for an appointment at CVS will have to go to the CVS website to do that. And the health department will continue to work off their pre-registry list for health department run events.
And again, you mentioned that once you are registered for a vaccine in Virginia, once you register, you will be notified by your state health officials or by your local health officials about what the process is from there. You don't have to keep calling back in. They'll reach out to you.
That's right. And know that has not been the case up to this point, but starting next week when we move to a centralized pre-registration system, you will get weekly updates saying, hey, you're still in the line.
Okay, wonderful. That's good to know because some folks have had questions once they registered, hey, am I on the list or what is my status? Let's talk more about this third vaccine that has been in development from Johnson & Johnson. It's up for FDA emergency approval at the end of this month. We could see doses coming in early March. How will that change? I don't want to say the game. How will that change our conditions here in Virginia? How will that affect this process?
Yeah, well, it will be thousands of more doses for Virginia, and every dose is a life saved. And so we really are excited about the prospect. February 26th is when that decision gets made, and we hope that starting around the first week of March, we'll see more doses. Now, one of the other things about the Johnson & Johnson vaccine is that it's a one-dose vaccine, and it doesn't have such stringent requirements in terms of cold storage. And so there'll be more flexibility in terms of the places we can use it, the ways that we can get it out. And I know that there are some concerns because its efficacy is not quite what Moderna and Pfizer's are. It's about 67% is what we're expecting.
How does that compare to the efficacy of the flu vaccine?
Great question. So it's better than what we see.
Better than what you get for the flu vaccine.
Yeah.
So if you get a flu vaccine, it's important to get your COVID vaccine as well. The efficacy rate is even better from Johnson & Johnson.
And one more point I'll make is that the Johnson & Johnson vaccine, while 66% effective, is close to 100% effective for hospitalization and against death. And so the severe consequences of COVID, the vaccine is very effective.
So there's no reason not to get a vaccine, whether you get the Pfizer that's currently available, the Moderna that's currently available, each of those in 2 doses, or the Johnson & Johnson, which hopefully will come out with just a single dose. What other vaccine manufacturers have products in the pipeline that we might look forward to as we get on into the later spring and the summer months?
Well, the 2 that are probably next in line, AstraZeneca is actually used in many different parts of the world right now. And so they're finishing up their clinical trials here in the United States. Likely the early part of April when we can expect to see that. And then Novavax is going through trials, and they're also being used in different parts of the world. So I expect, by April we'll have significant new supply with these different companies.
And if you are concerned about whether or not you should get a vaccine, there's a really good reason too. We're not just taking the test results and the clinical trials from other countries that other countries accept. We're putting these products under our own scrutiny, which is pretty good here in the United States. What should folks with allergies know about the vaccine? Many people are concerned that their susceptibility to one sort of thing may compromise them when they get the vaccine.
Yeah, so right now there are no clear contraindications to any of the ingredients that are in the vaccine. We expect some degree of response, some degree of symptoms. So about 10% of people who get immunized, what you're doing is you're presenting a new protein to your immune system, and it's revving up your body. And so things like a fever or some body aches or some malaise are really expected in approximately 10% of people who get vaccinated. Now, under 1% will have some kind of allergic reaction, sometimes some itching, sometimes some hives, but really, when tested across thousands and thousands of people, no severe allergic reactions. And so we're monitoring for that. In the very rare cases where there's an anaphylactic reaction, those get reported to the CDC. As that data gets collected, we'll provide more guidance about who may need to avoid the vaccine, but nobody at this point.
Would that kind of reaction, the anaphylactic reaction, present quickly after you've received the vaccination? So it wouldn't be like you'd get to go home and then 3 days you find yourself in dire straits. It would present itself rather quickly.
That's exactly right. And that's part of why our protocols, once we vaccinate, are to observe individuals for 15 minutes after the administration so that we can make sure that isn't happening.
That they're okay. All right, let's turn now to marginalized communities. There's been a lot of resistance, anecdotally and factually, that minority communities, black and brown communities in the Commonwealth have been reluctant to get the vaccine. We've explained that our testing is thorough. We've explained that our procedures are strong. What can we continue to do structurally here in the Commonwealth to bridge this gap that we have in trust in our medical community?
Well, I think first and foremost, we have to acknowledge the reasons that there is hesitancy. When you look at our country's history, we know that minority populations have not been treated well by public health and by governmental institutions. And that history has led to a lot of the hesitation that we're seeing now. So we've got to acknowledge it. We're creating forums to have that conversation so that people can recognize why has some of this hesitation been handed down from generation to generation. And then we need to make sure that people have good, credible information. So ensuring that people understand the breadth of the studies that have been done. The fact that with the Pfizer and Moderna trials, you had just not quite 10% of African Americans who actually participated in those trials. So we have good data around minority groups. And then really steering people away from social media and to the CDC and World Health Organization and the Virginia Department of Health for really credible, reliable information based in science.
It may be a little bit too early to talk about this, but we warned folks as we moved through Thanksgiving and through Christmas that family gatherings might be places where the virus could spread quickly and relentlessly as it does. Are we seeing now the back end of that, where we had a surge across the holiday season? and now we're kind of fading out with our case numbers and hospitalizations here in Virginia? And if so, is that a trend that we expect to reverse as we get into warmer weather, where perhaps people may go out more, be more casual, find themselves in restaurants without a mask or in social situations?
Yeah, well, without a doubt, the first week of January absolutely saw massive spikes in disease across the state. And now we're on the downside of that. We are seeing rates decrease in many parts of the state. That's really encouraging. I had some concerns that the Super Bowl would bring people back together. I'm hoping that that was not the case in most places. So we'll see what the data does. My hope is that we'll continue to see this downward trend. I do have some concerns with these variants on the rise. We've identified both the UK and the South African variant here in Virginia. As we've talked to colleagues around the world, I was on the phone last week with my counterparts in Israel. They have seen 70 to 80% of their cases are the UK variant, and that happened over the course of 2 months. Our own modelers at the CDC expect that the UK variant will be the dominant strain by the end of March, and so we really have to be committed to the things that we know work, to wash our hands, to wear our masks, to socially distance, and then as vaccine becomes available, let's get vaccinated.
We've talked quite a bit about elderly populations being most at risk and how Virginians over the age of 65 have been put into priority categories because they generally have the greatest risk for severe reaction to COVID-19 and hospitalization and death. What message do you have for young folks who feel, because of their age and youth and vitality, I remember all that, invulnerable? You don't feel like anything's going to hurt you. You're not going to die. You're not going to get sick. I'm going to go ahead with my life. Reiterate to folks at home why it's important, if you are younger, in college, early 20s, early 30s maybe, why this has to concern you too.
Yeah, well, the first thing I would say is that you're probably right. Young people who get COVID have very mild disease. But the point of getting the vaccine is not only to protect yourself from the rare instance of more severe disease in a young individual, but it's really against you unknowingly transmitting it to somebody who will have a more severe consequence. And so when we strive to reach herd immunity, to get 75 to 80% of our population vaccinated, we're doing that to minimize the transmission and to protect the most vulnerable. And so I'd encourage everybody to get vaccinated, even if you don't think you're going to get severely ill.
Let's talk again about those priority groups. We have 1A and 1B. Explain for the folks here who are watching on the web who are in those groups and why, and who will come next, presumably a 1C group.
Yeah, that's right. So 1A was really the folks that we knew were at highest risk either to contract COVID or to have very severe consequences of COVID. Without a doubt, from the beginning of this pandemic, we have seen terrible outbreaks in nursing homes, assisted living facilities, other congregate care settings. And so those long-term care facility residents and staff were included in 1A. In addition to that, frontline healthcare workers, doctors, nurses, other types of providers, but also dietary workers and janitorial staff in hospitals who are coming into contact with patients day in, day out. So that was Group 1A. Most parts of the state have moved through that. There are still some segments of 1A, perhaps an independent living facility or some like a home health nurse. So we're still prioritizing 1A as they come up. Now, 1B are those tiers of essential workers. And so if you go to that vaccinate.virginia.gov website, you will find the whole list there. Policemen, firemen, correctional officers, homeless shelter workers, teachers, childcare workers, folks who work in grocery stores or in manufacturing industries. There's a whole list of those core functions that our society really needs. And what's happening is right now, about 50% of the vaccine that every community gets is systematically working through those 1B tiers. The other 50% is being prioritized for individuals who are 65 and older. And so in addition to essential workers, 1B also includes individuals who are 65 and over and folks with underlying conditions. 1C, where probably about 3 months from now we'll be starting to transition to, includes other segments of the essential worker population. So folks who work in our energy infrastructure or in logistics or in finance. So there's a whole list of 1C. Again, vaccinate.virginia.gov will take you to the full lists of each of those categories.
Okay. Excuse me one second. Let's talk again about registration. So folks at home are worrying about how to get the vaccine. I've just flown in from Mars. I heard there's a pandemic, Dr. Avula. What do I do?
So as of this week, I would encourage everybody to go to your local health department website. You can go to vdh.virginia.gov. You'll see a map of the local health districts, and you'll be able to click on the site that takes you to your local health district website. As of next week, when we actually launch our centralized call center and our centralized registration process, you'll be able to call a number and have somebody walk you through or direct you to a place to get pre-registered. But more to come on that.
Okay. How has the pandemic changed our infrastructure here in the Commonwealth as far as dealing with a pandemic like this? Are we establishing connections and relationships and protocols that will endure for perhaps the next time?
Yeah.
And if so, what are they?
Yeah, so well, we often talk about the fact that this last year has just been the most complicated and biggest team project we've ever been involved in. And the response has just required remarkable cooperation and collaboration between health departments and health systems, between all of the health infrastructure and local governments. And I would say that the communities that really got out early with effective vaccination were the communities where the local governments, the health departments, the health providers were all really coming to the table and really connecting the dots well. And so I think there are practices there that we've learned. There are clearly spaces, places like convention centers and drive-through events that we now have really well thought out plans for. And a lot of that drew from our past experience, right? This isn't the first pandemic we faced. When I started in public health in 2009, we were looking at H1N1 as an emergent threat. And so every year health departments have planned around mass vaccination, and this really kind of took that to another level. People
are turning to doctors and healthcare professionals for good advice in the pandemic about registration, about getting shots, about side effects, and whether or not your allergies will contraindicate whether or not you should get the vaccine. They do not. Let's talk for a minute about the healthcare workers, the folks who, I don't know, I realize that it's just been about a year since most people kind of had the pandemic, COVID-19, on their radar. What's been the effect on our healthcare workers and on the folks who are on the front lines? It's been a difficult year for everyone, but I'm not working in a hospital every day. I'm not dealing with people on ventilators. What's the toll it's taking? How are they doing? How can we support them?
Yeah, well, without a doubt, it has been exhausting for so many of our colleagues who have been on the front lines. I mean, the day in, day out toll of caring for sick and dying patients, but also the anxiety of your own potential exposure and potentially bringing that back to your family and friends. And I would add one other category of early on, when we saw these just horrific outbreaks in nursing homes and assisted living facilities, I think there was a whole segment of our healthcare worker staff that was really forgotten in that. And so I think just acknowledging that, recognizing how the healthcare and public health infrastructure have just been under tremendous duress over the last 10, 11 months, and knowing that they are still pouring it all out right now so that lives can be saved. To acknowledge that, to give them a virtual hug, and to hope that when this is all over, that we all get a long vacation out of this.
It's interesting you mentioned that, because at what point will we know that this is over? What will the signs be? What will the indications be? What factors will we have to let folks know that, at least for the next time being, we can put our guards down a little bit?
Yeah, well, I think the data will have to drive that, right?
What data would specifically what we need?
So we will continually look at infection rates in communities, in percent positivity in communities, and the number of actual clusters and outbreak we're seeing in communities. And that will evolve some, especially with the onset of these new variants. And so, our epidemiology teams will continue to surveil that across the state. But the more data we have around how effective the vaccines are, there's the prospect that some vaccines might actually have to develop boosters in terms of these new variants that are coming on. So I don't think we're going to be out of the woods anytime soon. I do think this next 6 months we'll learn a lot about how much these variants take hold, how effective our vaccines are, and then ultimately how much transmission is happening in communities.
All right. So no answers anytime soon, but that's okay, because if you know what you're up against, sometimes that can give you strength in the fight. Let's get back to some today news. The CDC released a study that said 2 masks are more effective at combating the spread of the transmission of the COVID-19 virus than 1. Why is that? How should folks wear their masks now that we know this?
Yeah, so we've been hearing some, you've seen that trend probably over the last few weeks of people starting to double mask, and I think what I've been saying is that it makes common sense, right? The more barriers you have, the less likely it is that you're going to spread droplets and that you're going to breathe in droplets. But now we have the data to actually substantiate that, which is why there was a formal recommendation from the CDC today. So the key there is a good fit around the mask. The way that the CDC outlined their guidelines, a surgical mask underneath and then a cloth mask over. But really it is about making sure you have as good a fit as possible. Masks that have a metal wire that you can place over your nose are better than others. And then the double layer absolutely helps. What's not good is to have a mask that has one of those filters in it that actually allows you to breathe respiratory droplets out.
It flaps
yeah,
when you breathe
exactly.
like that. Yeah,
so you're sort of, you miss the point because you're still getting those respiratory droplets out there.
Explain to the folks at home how missing the point also includes wearing your mask below your nose.
Absolutely, because we don't just breathe out of our mouths, we also breathe outside of our nose, right? So we need to make sure that that mask is covering our nose, that it's fit well over our nose. Again, if you have a mask with a metal wire, that's better. But both to protect yourself and to protect others, it needs to fit snugly over your nose and mouth.
Is there any way for Virginians who are looking for a vaccine at this point in the process to request that they get the Moderna vaccine with 2 doses, to request that they get the Pfizer vaccine with 2 doses, or perhaps they prefer the Johnson & Johnson, if it becomes available, when it becomes available, with a single dose? Or is it just a matter of where you are, here's what you get, keep going?
Right now, vaccine is in such short supply that it really is, there's not much choice at all. So the vaccine is primarily being distributed based on the place's ability to store that vaccine. The Pfizer requires negative 90-degree storage, but there really is not a way to choose that. I suspect, down the road a few months where the vaccine is much more plentiful, you can start picking what sites do you want to go to, but that isn't the case right now.
Folks across the Commonwealth, especially in rural areas, have been worried about equity in this process. And because they're not in more populated urban areas where maybe you could have a vaccination event, as we've had several at Richmond Raceway, for example, there aren't those sort of places set up in Southwest Virginia. How can we explain to those folks how the process works for them?
Well, I would first say look at the data around it, just how many folks have been vaccinated in those communities. There are parts of Southwest Virginia, Buchanan County, Wise County is a couple of examples where you have tremendous vaccination rates. And I know it may not feel like that when you're on the ground, but the fact of the matter is the health departments and other partners in those parts of the state have gotten vaccine out at extremely high rates. Their vaccination rates per capita are actually better than many, many other parts of the state. And so we're working hard to make sure that everybody gets vaccine, but everybody right now feels like they don't have enough, they don't have what they need. And the fact of the matter is that they don't. At
the opposite end of the spectrum, you have folks who say they will never take it, don't want it, don't want a mandate, this is government control, that sort of thing. Is there a mandate for anyone to take the vaccine if they don't want to here in the Commonwealth?
Definitely no mandates. These vaccines are under what's called an emergency use authorization from the FDA. While they are under an EUA, there's no way for a governmental entity to mandate or require that you take a vaccine.
Okay. Simple answer there. But we do recommend it.
Absolutely. Absolutely.
And it could help your family. Let's talk a little bit about schools. Governor Northam, in this last week, has indicated that he would like for Virginia schools to return to live classes in some form or another as of March 15th, just a few weeks away from now. And that is whether or not teachers and students have been fully vaccinated and protected. Why? Is that, I can't ask you why that's his position, he takes his own position. I will ask you, what's the data that supports that being a good move, and how should folks be comforted by the information you're giving them? Yeah, well, this has obviously been a robust conversation for much of the last year. It is in my household as well. We've got 5 children, and my wife is a school teacher. Oh. But the reality is that we, again, have to look at the data, right? We have looked at data both in Virginia for schools that have been in person around the country and around the world. And what we see over and over and over again is that schools that are effectively doing community mitigation, they are requiring masks, they're ensuring distancing, they're cleaning well, they're screening out for symptoms,
are remarkably safe places for both kids and teachers. Now, you are hearing stories, people are getting COVID, right? You'll see teachers or students that turn positive, but they're not getting it in schools. They're getting it in social gatherings and in other facets of their life. And so I think we really need to be reassured by what we're seeing is that you're not having significant outbreaks or significant transmission in schools that are doing this well.
That is one of the odd things about this, because you'd think that when you get kids together in a place like that, practically, or it would seem that that's the case, but it is not. Let's take that a step further now. So schools are not really the sort of vector for transmission that we expected. There are interruptions when there's a positive case and then all the students who've been in contact have to be quarantined or should be isolated for a time. Should that concern parents? Also, it seems a little bit disruptive, but that's just sort of how we have to do things these days.
It is, and I think some of the school systems that have been able to kind of hybridize and have concurrent virtual with in-person have been able to mitigate against that well. But for the schools that are able to effectively maintain 6-foot distancing, you really minimize the impact of exposure and of potential quarantining. And so in many parts of the state, we've seen schools that have really held to that 6-foot distance, and the potential exposure hasn't affected as many kids.
How is a vaccine under development that would be authorized or that might be authorized for the very youngest of us? Right now, vaccines are not authorized for anybody under 16, I believe. That's right. Will that change? And if so, will our vaccination program just be broadened?
Yeah, so we're a few months out from that. The Pfizer vaccine is currently the only vaccine that is eligible for people down to age 16. Back in early December, they were authorized to add kids down to 12 to their trials. Okay. So I think we're still probably 4 to 5 months out from having good data around children and a formal recommendation, but even then, it'll be only kids down to 12. So I think we're months and months away from having a vaccine that's that younger kids are eligible for.
Here's a question, it's off the top of my head. Do you think that we'll get COVID vaccines the same way that we get regular flu vaccines? Is this because of the variants that are coming? Will this be a cycle for us, do you believe? Is there a possibility of that? You get a flu shot, you get a COVID shot.
I think it's pretty likely for these next few years that we're going to require annual vaccines and boosters that are tweaked based on variants. You know, the coronavirus has been around for decades. It's always been incredibly mild disease. And so for the first time, we're seeing these much more severe consequences of COVID mutations. And so not for the first time. We've actually had other very severe mutations in SARS and MERS-CoV as examples. But I think if we continue to see circulation, if our surveillance shows that these are continuing to transmit around the world, I can see this being an annual event.
This pandemic may be an opportunity for people to regain some trust in science, because so much of this work is based in science. Dr. Robert Wynn from UVA told us earlier today that these vaccines are the Beatles and Beyonce, not overnight successes, but things that have been developed over time in the shadows, places that maybe not be so public. But this is really the tip of a fantastic spear that has a long history. Explain a little bit about that, how vaccines are developed. Maybe that will let folks at home feel a little bit more at ease if they're reluctant to get a vaccine.
Sure. Well, we've had decades of experience trying to develop new vaccines, and we've done that in a lot of different ways. One of the remarkable advancements has been the way that these particular Moderna and Pfizer vaccines have used new methods of actually developing an immune response. The basic idea is that you are somehow presenting your body, your immune system, with something that looks like the virus. And in turn, your immune system develops antibodies. It develops defenses against that viral particle so that the next time your body sees it, you're ready. You're ready to fight it, you're ready to defend against it, and you don't have the same risk of having severe consequences. Now, there's a lot more detail we could go into about the different platforms that are used, but the basic idea is that your immune system is being readied for a future exposure.
And this has been going on for hundreds and hundreds of years. Was the smallpox vaccine one of the first that was developed here
Yeah,
in the U.S.?
It absolutely was, and now we don't see smallpox anymore. And so I think that's a great example of where people, particularly folks who are more hesitant around vaccination, forget a time where we had lots of circulating infectious diseases, yet vaccination has changed that trajectory. I mean, when you look at the causes of death from the early 1900s, the top 5 are all infectious diseases, and now that's just no longer the case. Part of that is public health interventions around hygiene, but a huge part of that is vaccination.
All right, just got a question in my IFB from somebody who's watching along with us here on the web. Can couples make appointments together for their vaccines? If mom and dad need to go together, can they do that?
So if they are both eligible for various reasons, for example, if they're both over 65, or if one partner is over 65 and the other is an essential worker, then that might be a reasonable thing, and health departments and other providers will work with you to schedule that together. If not, then the partner is going to have to wait until they're eligible.
Okay. And one final question, and I think that, again, this came up relatively recently. Don't know why no one's mentioned it before. Don't feel on the spot to answer this. How come, why do we have to have a vaccine that's administered by injection? Some people don't like shots. They're afraid to get a shot. Why can't our vaccine be taken orally, like your ibuprofen or your acetaminophen?
Well, there have been examples of oral vaccines that have been effective in the past, but those typically are live virus vaccines where you're actually ingesting or putting a live virus into your body to generate a response. The injectable vaccine is the most effective way to get this particular platform. What's happening is you're injecting a small amount of genetic material into your body. Your body reads that genetic material, creates the protein that you see, the spiky protein that's on the surface of every coronavirus, and then your immune system responds. That wouldn't be possible through an oral vaccine, and I'm pretty sure that nobody's willing to take a live virus COVID vaccine.
Certainly not. All right, we're going to wrap up our online discussion now for Vaccinate Virginia. Final comments, Dr. Avula, either on your experience over the last year or advice that you'd like to give our viewers and listeners.
Yeah, this has been extraordinarily difficult for all of us. I mean, this has been, for many of us, the hardest year of our lives. And we have just heard the same messages over and over: wash your hands, wear a mask, socially distance. And so my hope and my encouragement would be that we can hold on to those things for just a few more months. You know, there's hope on the horizon. Finally, we have a vaccine that's incredibly safe and incredibly effective, and everybody who wants to get vaccinated will get the chance to be vaccinated. But let's do this. Let's do this together, and let's be patient, but let's make sure we get vaccinated and can move on from this together.
All righty, Dr. Danny Avula, thank you very much for your expertise and your time, and I'll say personally your dedication over the last year in trying to bring Virginia safely through what is easily the most terrible public health crisis that most of us have experienced in our lifetimes. Thanks as well to the Virginia Department of Health, and for all of our experts who've been part of our discussion this evening. Thank you at home for listening with open ears and an open heart. For all of us here at Vaccinate Virginia, I'm Juan Condi. We'll join you again in a couple of weeks. Until then, wear a mask, practice social distancing, and register for your vaccine.